Okay, I think we will get started since it is 7:05. For those of you that were just admitted to the Zoom, thank you for your patience. We had a little bit of technical difficulty, but it looks like we are started. So for return viewers or first time joiners, I'd like to say welcome. My name is Stephanie Hubert, and I am the Executive Director for Cornell Cooperative Extension in Putnam County. And I'm very pleased to provide you in partnership with the Fairfield Westchester Professional Horsemen's Association a 4-part series called Horse Care 101. Last month, as you might remember, we spoke about cost and commitment, and that presentation has been recorded and will be up on our YouTube channel, for which you will all get invited to after the series. This month, we have session number 2 entitled Routine Veterinary Care. And I'm very pleased to welcome Dr. Kim MacKinnon from Miller and Associates, local veterinarian, and she is going to share all of her knowledge with us for the next hour, really about annual health care, which includes dental, deworming, yearly vaccinations. And, Kim, I didn't get to ask.
I have a bio on her.
Oh, I'm sorry.
No worries. So Kim went to St. Mary's University in Halifax for her undergraduate, and then attended Atlantic Veterinary College on Prince Edward Island in Canada. She graduated in 2019. And she has been living in New York for about a year and has been working at Miller and Associates since she moved to the US. She is Canadian, so forgive her for her funny accent. Take it away.
Awesome. Okay, well, thank you all so much for having me. I hope that after this presentation, you will be able to better understand, or maybe have, more of an idea as to the importance of the role of having a relationship with your veterinarian, and kind of the nitty-gritty basics for kind of what a year's worth of healthcare, preventative and sort of in terms of treating illnesses and things, might look like as a horse owner. So we'll get right into it. The presentation is just titled Veterinary Basics let's get going here. All right, so perfect. Okay, so I guess we'll start off. I'll tell you just a quick 4-in-1 here about who I am. So as was already mentioned, I graduated vet school in 2019. Up in Prince Edward Island in Canada. I did my undergrad also in Canada in biology, and finished that up in 2015. On the photo here in the middle of the slide here, this is my husband. We live down in New York now with my 2 very large breed dogs. And in terms of my background in horse ownership and being a horse person, my background is mostly in polo, but I also have done some fox hunting as well, and have dabbled in the jumper ring. So that's kind of my horse background and a little bit about who I am. So before we get started, I have a series of slides here as sort of a guideline, but if anybody has any questions at any point during this presentation, please just say them or mention them in a, just pipe up and ask your questions. We don't have to necessarily save them till the end. So let's just talk a little bit about what I kind of had thought or intended to go over today before we get going, just so you have a rough idea of what's on the menu here. So as was already mentioned, vaccines, I thought we could go over what is a routine, what do we consider routine vaccines for the horse owner versus what are kind of the extras, I guess, if you want to think of them in this way, or risk-based vaccines. We can also go over deworming protocols in terms of what is currently recommended by the American Association of Equine Practitioners versus what is kind of old news. There's a lot of information out there about vaccines and deworming, and it's sometimes hard to sort through what is like current and what is relevant, because a lot of the information that's out there that you've maybe heard at your barn or amongst your friends or something about, oh, you know, we deworm on this schedule, like some of that information is outdated. So I was thinking we could go over that and chat about what's current in the deworming world, because it's very important. A lot of people think deworming, like, okay, boring, we deworm, you know, with this product every month or whatever, but it's actually a really important topic that I'm glad that we get to chat about today. I also thought it would maybe be helpful to go over some common illnesses that I see on an emergency basis, and also that you might see as a horse owner in your barn with your own horses or whatever. And I guess I tried to gear this in at the level of sort of a horse owner that has maybe never encountered these problems before, or maybe they have and they just want a little bit more information about it. So some of the issues I was thinking we could chat about would be colic, that's a big one, lacerations. We can touch on metabolic disease at the end if people have specific questions, because that in and of itself is a whole presentation, and there's so much information out there about, you know, Cushing's and insulin resistance and all of these other things. So we can leave that to the end, because that's just a whole can of worms that I can talk for hours about, I'm sure. I also thought we could go over colic as it pertains to like surgical versus medical and other surgical versus medical issues, as well as hives and foot abscesses. And then choke, I thought we could also chat about as well. So those would be the common things that I see on an emergency basis that would be relevant to a horse owner. Obviously, there are so many other things that we could talk about in terms of like horse healthcare and like different diseases that can, you know, come about, but we just don't have time for that. So I thought we could maybe just focus on the main ones that I think would be relevant to you folks. And then the other topic that I think would be helpful to chat about is nutrition as it pertains to senior horse management. Again, like nutrition is such a broad topic. You know, you have people that go to school for years and years to become nutritionists and to become experts in this field. And you can break it down looking at, you know, nutrition for the athlete, nutrition for a foal, nutrition for, you know, an adult horse not in work. Like the caloric needs and the nutrition needs of horses depends so much based on what they're doing, their age, concurrent diseases. So that's such a huge, broad topic. We will just tackle the nutrition of the senior horse for today. And of course, at the end or something, if anybody has any questions about like particular questions about nutrition, I'm happy to try to answer those. But this is just a rough outline as to where I thought we could kind of start with our talk today. So we'll start off with vaccines. When we, you know, this is the season of vaccines. You know, we typically around here, we vaccinate twice a year, kind of in the fall and in the spring. And so there are so many factors to consider when it comes to vaccinating your horses, right? Like so many things. Geography, where do you live? Do you have stagnant water around you? Are you living in an area where, you know, there are tons of insects and mosquitoes are a big problem? Because a lot of things that we vaccinate for are vector-borne or transmitted by insects and mosquitoes, flies, different things like this. You know, what sort of wildlife do you have around you? Are you living in an area that has rattlesnakes? Like there are so many geographical considerations when it comes to developing an appropriate vaccination schedule for your horse. That's super key. Prior vaccination history matters. The age of the horse, is the horse exposed to other horses? Do you have a history of travel? Do you intend on traveling? Do you have any shows that you're planning on going to? And if so, what are the requirements of the showgrounds or of the particular show that you're going to in terms of vaccinations and what they need? What environment do the horses live in at the barn? And management strategies play into it a little bit as well. Core vaccines. Okay, so when we talk about core vaccines, what does my horse need? Like, what do they need to be well protected? Again, this kind of depends a little bit on the factors that we just talked about, but the AAEP, which is the organization that governs equine veterinarians in North America, the American Association of Equine Practitioners, they've released this statement that's on the slide as to what a core vaccine is. So, it's a vaccine for severe disease, for highly virulent or contagious diseases that are relevant as they pertain to public health. Like, do they have a public health significance? And it has to be a vaccine that's demonstrated to be safe, that supplies a sufficient enough benefit for us to even do it, and a level of risk that's acceptable for the horses that we're vaccinating. So that's what they deem important as a core vaccine. So we generally have 5 core vaccines in this area that we consider super important and necessary for all horses. So those 5 are tetanus, rabies, the encephalitides, which are mosquito-borne diseases, so Eastern encephalitis and Western encephalitis, and then West Nile virus, also a mosquito-borne disease. So those are kind of the big 5. And I'm sure those of you that own horses are aware of maybe some vaccines that your horse gets vaccinated for that's not on this list. And that would fall under the risk-based category of vaccinations. So there are many of those. And again, which risk-based vaccines your veterinarian chooses to vaccinate your horse with, or that everybody comes up with is the correct vaccine protocol for that particular animal, depends on that long list of factors that we already went over. So a super common one that I'm sure everyone has heard about is flu rhino. So that's equine influenza and herpes virus. That's a really common vaccine that's required at showgrounds. Many different barns will require that because that is a pathogen that is transmitted from horse to horse, from nose to nose contact. So in environments where there's a dense horse population at boarding facilities or at shows, that's a really common one that's required. Most shows will require proof of vaccination in the last 6 months with this vaccine. Other risk-based vaccinations could include botulism. If your horse is being fed haylage, that's an important one. Potomac horse fever, another really common one. If your horse is stabled in an area where there's stagnant water, that's when that becomes relevant. You've probably heard of strangles. That's another vaccination that is typically given up the nose, but can also be given in the muscle. That's a risk-based vaccine. And then there's a bunch of other ones that I've listed at the bottom here. We've got anthrax, rotavirus, that's particularly relevant in foals. Equine viral arteritis, that's relevant in stallions. And then you've got the Venezuelan encephalitides, leptospirosis, the snake bite. There are more, but those are probably the more common ones that you would encounter or read about. The vaccine schedule really depends on, I feel like the answer to all of these, like what should I vaccinate my horse with, when? The answer is always it depends, because it depends on, has your horse had a primary series of vaccines? Or did you get this horse off of an auction truck, off of a meat truck, and we have no idea what its vaccination is previously? All of that matters, because in order for a horse to be adequately vaccinated and have adequate immunity against something, they have to have received its primary series of vaccines. And that's kind of the initial shebang. And then subsequently they get boosters every, 6 or 12 months, depending on what vaccination schedule your horse is on. So, and again, pregnant mares, foals, that's a whole other can of worms. And it's a lot to remember. So that's why we're here to help guide you as vets through the process to figure out a vaccination plan that works best for your horse. In terms of, where they're stabled, how old they are, their vaccination history, all of that jazz, because it can get complicated for sure. So that's kind of nitty gritty on vaccines. So let's move along to deworming. Oh boy, deworming. So how often you deworm, this is such a hot topic. I love talking about it because it really matters. Okay. And I know people think, oh, deworming is like boring. You just give them the dewormer and then you're done with it. Like you don't have to think anymore about it, but we really do. And the reason why is because we don't have any more dewormers on the market. We have what we have. There is no research on the horizon to suggest that there's anything new coming out anytime soon. And that's problematic because when we are deworming willy-nilly, giving dewormers to our horses every month or every 2 months or whatever, without knowing what they're shedding in terms of parasites, we're promoting resistance, which is effectively making our dewormers useless when we really need them. So deworming matters. If there's one thing that you take away from this presentation, I hope it is that you consider to do fecal egg counts on your horses, because this is what we use as a guideline to figure out what we need to do with deworming, because depending on what sort of fecal egg count looks like, which is obtained by taking a small sample of manure, we look at it under the microscope and basically figure out how many eggs of different parasites are present per gram. Okay, so depending on what that count is, that's how we determine how often to deworm your horse. And some folks will think, holy smokes, that sounds expensive. But fortunately, the cost of a fecal egg count is pretty cheap at most vet clinics. And it will probably save you money in the long run, because if you know where your horse is on the sliding scale of how many parasites they're shedding, you can deworm effectively. And maybe you don't have to deworm 3 times a year. Maybe you can deworm twice a year. So it's helpful to know where on the sliding scale your horse is in terms of the eggs that they're shedding in their manure. So the categories I have listed on the slide here are low, moderate, and high shedder. And those numbers are on the screen here. It doesn't really matter to you much as a horse owner, but these are sort of the cutoffs that we use to decide where your horse is on the shedding scale. And then the egg count that we use is called the McMaster fecal egg count. That's just the name of the way that we do it. So the lowest tier of category, okay, is a low shedder. So most horses fall in this category. They're low shedders. They are adequately dewormed. They're not resistant to dewormer, and they're not shedding many parasites in their manure. So in terms of the timing, we recommend fecals be performed prior to deworming in the spring and the fall. In a perfect world, we would do fecal egg counts twice a year. That's not possible for everybody, whether it's logistics or finances, and that's fine. But if you're going to pick a time to do a fecal egg count, do it in the spring. So the schedule that I have on the screen here are suggestions of which dewormers to use at which time. So generally we say in the spring, use an ivermectin or a moxidectin, and there are tons of dewormers out there that like different brand names and things like this, but these are the active drugs that you want in the dewormer at this time of year. And I'm happy also, just as a sidebar, to like disseminate this presentation. If people want this material in writing, that might be helpful, just to consult and have everything all in one place if there are any questions. So I'm happy to send this to whomever so it can get distributed. So you don't have to remember all of this. In the fall, super important that we deworm for tapeworms. Tapeworms are not a huge problem in horses, and that's because we've gotten good at deworming. But in naive populations of horses that have never been dewormed before, tapeworms can be problematic. So that's why we always want to, cover ourselves and deworm most times in the fall with something that contains something that will get with a dewormer that will contain praziquantel, which is good for tapeworms. So you can use a combo product, Zymectrin Gold, Quest Plus, like there are tons of different products out there that you can use, but those are the two dewormers that you want in your dewormer for the fall. And this is for the low shedder category. The next category is moderate shedder, which, as the name suggests, these horses are kicking out more eggs in their manure. So between 200 and 500 eggs per gram. And same deal as with the low shedders. Ideally, we would do a fecal twice a year, once in the spring and once in the fall. And this is the deworming schedule that is recommended for horses that fall in this category. So basically you have an additional deworming in the late summer, which is when we hit them again with ivermectin. So in July. Otherwise, the recommendation for spring and fall is the same as horses in low shedding category. The next category is high shedder. As the name suggests, these are horses that are kicking out a lot of eggs per gram in their manure. So not many horses are in this category. However, if you look at the amount of eggs in a pasture, most of those eggs are coming from high shedders, which is kind of a bit of a head scratcher because most horses are low shedders, but it's these high shedders that we have to worry about. And the, let me just see here. Okay, there we go. The high shedders are the patients that we have to worry about, but those are the ones that are kicking out tons of eggs in the pasture for everybody else to consume. So it's important that these horses get dewormed probably 4 times a year, which sounds like a lot, but the other key point for these guys is to potentially perform a fecal egg count reduction test. So when horses are creeping up into this high shedder category, it's important to figure out, okay, are these horses resistant to the dewormers that we're giving them? Because if they are, we need to either switch up our dewormer or get a little bit strategic with how we're deworming these guys. Because again, we only have so many dewormers on the market and there aren't any more that are on the horizon to be released for consumer use. So that's when the fecal egg reduction count test comes in handy. But this is the schedule on the screen here that we suggest for these horses to be dewormed is 4 times a year with these products. And, kind of like I've already alluded to, this gets especially problematic when I go to barns and my colleagues go to barns and we say, when was the horse dewormed last? And they say, oh, no worries, we do it every month or we do it every 2 weeks. And I'm like, no, because this is what promotes resistance. And, it becomes problematic when we have horses that have extremely high parasite burdens and we have no treatment options. That's when we're really hooked. So that's why this matters. And as you can probably tell, this is like kind of a passion project of mine because it just is. So it's very relevant when it comes to horse welfare, especially for these guys that are being, have an unknown sort of deworming protocol. And anyhow, I won't bore you with any more details on the deworming.
So, excuse me, Kim. So what if you have several horses in your herd and they live out together? You need to do a fecal egg count on all of them?
Ideally, yes, that's what you would do. However, there's also an option to do a pooled fecal egg count. So that basically, like, if you don't know, say for instance, you've got 5 horses in a paddock and everyone's pooping in the same paddock and you can get a sample of that manure and then submit it for a fecal egg count and we can see how many eggs per gram is in the pooled sample. For many reasons, this is kind of problematic, but it will give you a general idea, how many eggs per gram the whole herd is shedding. We don't know who's shedding what and who is in which category, but for very large facilities, sometimes it's not possible for every horse to have a fecal egg count done, and that's fine. That's when the pooled fecal egg count can be kind of helpful. I guess it's more helpful when we do that and we see a very low number of parasites, then we can maybe feel more confident to stick to a twice a year deworming protocol. versus if we take a pooled sample and then the fecal egg count is astronomical, it's above 500, then it's maybe more important to go back and see who's shedding where, because again, we want to be as stingy as possible with the dewormer, but we also need to be effective. So I would say pooled samples, it's okay to do that. It's not like the perfect thing to do, but it's fine. And it's just it's a guideline to try to deworm, each horse the best way we can. But like when we go to places and there's like 50 horses in a field, I mean, like it's
No, yeah, I'm not talking about that many. So let's say you have 5 horses in a field and it is possible to get individual fecal egg count on each horse. So what if your herd is mixed? Do you deworm everyone according to the highest shedder, or like how would you handle that?
Yeah, so I would deworm each individual horse based on what their fecal egg count is. So again, and ideally, if you don't have a ton of horses together and you can get a fecal egg count on each horse, maybe, Fluffy needs to get dewormed twice a year, but you've got, Joey that needs to get dewormed 4 times a year. That in an ideal world, we would get a fecal egg count on every horse and deworm them according to what their fecal egg count is. Does that make sense?
Yes. So if I have a horse that is a high shedder, that does not affect the potential parasite problem in a horse that's a low shedder because they're living together.
Exactly. Yeah, for sure. So that's a good question. The low shedder, it basically, like a lot of times when you have a high shedder, it's because there's a dewormer resistance issue. So just because there's a dewormer resistance issue in the high shedder doesn't mean that the low shedder is also going to be resistant to dewormer. So just because you have one high shedder doesn't mean that it's putting the rest of the herd at risk of also being high shedders, unless you're not deworming, period. I mean, in that case, if you're not giving any dewormer at all, then for sure the high shedder, I mean, if the low shedders aren't being given any dewormer, like their parasite burden is going to be increased.
Right.
Does that make sense? But the high shedders, like they're continuing to kick out tons of eggs.
Yep.
As long as you're deworming the low shedders appropriately, it shouldn't matter if you have 1 or 2 high shedders and a couple low shedders. They'll probably continue on their schedule, and the high shedders might always be high shedders. And you might not necessarily be able to knock that down too much with dewormer, but the goal is to try our best to keep everyone under some degree of control.
Great, thank you.
No problem. So we kind of already talked about a lot of this, but there are other things other than deworming that we can do to control parasite problems in a herd, right? We can rotate pasture if you have that land available to you. You can cross graze pastures with ruminants. If you have ruminants available to you, not every barn has ruminants they can kick out to cross graze, but if you have them, that's great. Removing manure frequently. I think this is the most important piece, because the longer that you let poop sit in a paddock, those eggs are going to hatch and become a problem. Horses are going to ingest them, and then the cycle is going to continue, right? Because these parasites are transmitted by fecal oral contamination, basically, whether you're feeding them hay on top of a, disintegrated pile of manure, or, whether the horses are physically eating the manure, which is kind of gross, but it does happen. That's how these parasites are transmitted. So removing manure is a great, very simple, very cost-effective thing to do to reduce the parasite load in a paddock. Harrowing or dragging the pastures in warm weather is a great option. Again, just to keep them clean, and avoiding overstocking pastures. So a lot of times there are laws that sort of dictate how many horses you're allowed to have per acre or whatever. At least this is the way it is in Canada. I'm sure it's probably similar down here, but avoid cramming a bunch of horses into a small space. And then ideally, if you've got mares and foals, you will not use the same pasture year after year, because that will cause problems with the foals getting reinfected in the spring with old manure. So if there are any horse owners that are listening that have mares and foals, if you can rotate pastures from year to year with those, that's ideal. So this kind of, how do I know if my dewormer is even working? That's when the fecal egg reduction count test comes into play. So essentially how you know your dewormer is working is You take a fecal egg count, wait a couple weeks, take another fecal egg count. If the fecal egg count has reduced by 90% or more, you're good. If it hasn't, then we probably have some resistance. So, okay, I will not continue on the dewormer topic anymore unless people have questions. Now we can move into senior horse nutrition and management. There are many considerations for providing adequate nutrition for older horses. And this is such an individualized thing. So how are the horse's teeth? Does the horse have other diseases? Does it have Cushing's? Does it have insulin resistance? What's its parasite situation? You know, what other hormonal or metabolic challenges does the horse have? All of this stuff matters because as horses age, their digestive system becomes essentially less effective and their ability to absorb nutrients is not as great as it was when, you know, the horses are 3 or 4 years old. So we have to be careful in terms of what we're supplementing them with to make sure that they have all of their, you know, their vitamins, minerals, essential nutrients, all of those things are met in the feeds that we provide. Again, because their digestive system isn't working as it should. And we have all these other factors oftentimes stacked against us in older horses. So there's lots to consider. And it's not always a simple, straightforward answer, which is why it's important to chat with your local vet and develop a plan to provide adequate nutrition for your senior horse that works best for them and for your horse's management situation. Dental care is so important in old horses because the bottom line about this is if a horse can't chew its food, it's not going to be able to extract the maximal amount of nutrients that it needs from the hay or from the grain or whatever else the hay cubes, whatever else you're feeding. And then also, if its teeth are out of whack, oh boy, we are opening up a can of worms. Risk of choke goes up, risk of colic goes up. Letting a senior horse's teeth go for a few years is not a good idea because our risk of all of these problems goes up. And dentals are really, they're not invasive, and there are so many things we can do to decrease the stress on the horses. When we're doing dentals, like sedated dentistry is really important to make sure we can get to the back of the mouth. You know, if the horses have sensitive teeth, we can use vet wrap on the speculum. Like there are so many different things we can do to make this a comfortable, low stress procedure for them. And horses should never be sore after a dentistry as well. You know, if you have heard of people that have had their horses' teeth floated and they haven't been able to eat for X number of days, that is not normal. So it should not be a pain-inducing procedure for them to have their teeth done. So the reason why oral exams are important, especially in older horses, is because their risk of having teeth that are mobile, wiggly teeth, goes up. You know, they can have funky bites, malocclusions. Their teeth are not coming together as they should. Whether they have, you know, loose or broken teeth, there are many reasons why their occlusion might not be appropriate. But that's important to make sure that they can, because they grind their teeth in the circular sort of way, like that's how they chew food. It's not up and down like the way that we chew food. So it's really important that their teeth are all gliding in a smooth sort of way. Elsewise, they won't be able to get the most out of their food. It's important also because we check for gum problems and, you know, tongue problems. Do they have ulcerations on their tongue? Is there evidence that there are sharp enamel points digging into their cheek that's bugging them? Because that can also, again, when we get back to this idea of getting the most out of the food that you're giving them and chewing the food to an adequate forage length that should be between 3 and 5 millimeters, all of these things are so important and can basically present bumps in the road as to why the horses can't chew their food effectively. So many things that we're checking for when we do dentistries and dental exams. So you've probably been at a feed store or have heard people in your barn say, oh, this horse is on senior. Like, what does that mean? because I feel like, again, like I said at the beginning, nutrition is such a broad, detailed, intense, huge umbrella topic that people study for years to become proficient at. So the nitty-gritty as to what makes senior food different is the amount of soluble carbohydrates that's in the food, so sugar and starch. And typically senior food has low levels of soluble carbohydrates, and there are many reasons for that, but that's kind of what you maybe need to remember. And then high fiber with digestible sources of fiber. So something like beet pulp, soybean hulls, alfalfa meal. All of those are examples of sort of high fiber, very digestible fiber feeds.
Excuse me, Kim, we have a question, if you don't mind.
Sure.
The question is, how often do you recommend dental exams?
Great question. So in a senior horse, every 6 months is ideal. If that's not possible due to finances or logistics, if you can at least get them examined once a year, that's awesome. Because the more often that we do dental exams, the quicker we can get on top of problems before they become a bigger problem. And that ends up benefiting the horse. It ends up benefiting your checkbook because things don't turn into an expensive veterinary bill. So nipping problems in the bud before they start by doing dental exams every 6 months is especially important in senior horses, maybe a little bit less so in horses that are, young and middle-aged. You can probably get away with every year unless we know that there's something going on in the mouth that's funky that needs to be checked every 6 months. That's kind of what we recommend usually. Senior feed should be palatable, easy to chew, have a decent protein content, sufficiently high amount of fiber. It should provide essential minerals like calcium and phosphorus. Those two are really important in the correct ratio. It should be energy dense enough to support the body condition of the animal that you're feeding it to. And then the other thing that's very helpful for these older horses is to offer food, specifically grain, in a slurry with water, and that boosts water intake. That becomes especially relevant when horses are going through changes of seasons, which this is a perfect example of. This winter was like a prime example of why it's important to ensure your horse is ingesting adequate amounts of water to avoid dehydration. When the weather is fluctuating, they go on strikes where they feel like they don't need to drink, and that's when we run into trouble. So if you have a senior horse, try to offer the food in a slurry to help increase that water intake, and we will be doing everybody a favor. It also makes the food softer and easier for them to chew and less likely to choke. In terms of managing senior horses, there are many more things that come into the equation other than just nutrition. But it's important to develop a plan that works for your horse and your management strategies that you have implemented. Just the main thing is just to try to be really attentive in terms of, has their body condition score changed? Does it seem like they're dropping weight all at once? Are they eating? Are they dropping food? It's important to provide them with appropriate barrier care, make sure the barn's well ventilated, provide routine dental care, avoid feeding them moldy or dusty hay, because that opens up a can of worms of respiratory problems, which can be a real pain in the neck to deal with. And then scheduling routine checkups with your vet to catch problems before they become a bigger problem. That ends up benefiting everybody involved. Okay, let's talk about common illnesses. I hope this will be an interesting part of the presentation because I love emergency work and we see so many wacky things outside of regular business hours. I'm hopeful that we can go through some common issues that you might see as a horse owner, and at least to make you aware of what to do when you come out and see your horse three-legged lame, like what to do when you come out and see a laceration like that, what to do when you come out and see that your horse is thrashing around and colicky. So let's talk about some common illnesses. And I thought I would try to focus on the ones that I see the most on an after hours basis, but we will have time, hopefully, to go through some of the other illnesses too, if there's something else that you can think of that seems particularly relevant to your horse. Or if you have any other questions, we can talk about those too. So these are some common ones: colic, lacerations, lameness, metabolic diseases, infectious disease, surgical versus medical conditions, hives, foot abscesses, choke. There are so many, but these are some common ones that we see a lot of. And when we think of common illnesses, you know, it all depends. I feel like that is my answer for everything. When anybody asks me a question, my answer is always, it depends, because it does, it depends. So common illnesses as a phrase depend on many things: the age of the horse, the management and stabling strategies, the nutrition that the horse is getting, what sort of workload are they in, what are they doing for exercise, where are they turned out, what medical history do they have. Many things come into the picture. Let's talk about colic, because I think this is probably the first one that most people think about when they think of common illnesses in horses. There's a phrase out there that I didn't come up with this, but in vet school, they said horses were designed at 5 p.m. on a Friday, which I think is pretty accurate. So colic is one of these examples. Like, you know, my husband always asks me, like, how on earth do horses even survive in the wild? And it's a great question because, you know, they're so delicate. We've domesticated them. They're such delicate, but such hardy creatures. Colic is a great example of something that many horse owners have had to deal with at some point in their life. So let's talk about it. Colic describes clinical signs. Colic is not a diagnosis. Like, colic basically means abdominal pain, which can be from many things. It can be a primary gastrointestinal problem. So when we think of colic, we think stomach. Okay, so that would be a primary GI problem, primary gastrointestinal. And there are so many parts of the horse's gut that can become diseased, that can become a problem, because there's a lot of guts in that barrel. There's a lot of stuff that can go wrong. So impaction, torsion or a twist, displacement, you know, colon is where it's not supposed to be. We can have strangulating lesions, which is when we've got pieces of small intestine that, or not even necessarily just small intestine, can be large colon too, that kind of twist and the blood supply gets cut off. We can have enteritis or inflammation of the gut. We can have gas colic. We can go on and on. There are so many things that can go wrong with the horse's guts. Secondary causes of colic, you can have a horse that's looking colicky, that's biting at its flank, that's pawing, that's thrashing, that's throwing itself around, that does not have a gut problem. We can have horses that have pain associated with another condition, and they can look colicky, even though the issue is not in their gut. Say, for example, last week I had a horse that was in atrial fibrillation, so it had a heart problem, and that horse was looking colicky. So this is where it's important to get your vet involved and at least give them a jingle or shoot them a text or something like this and say, hey, this is what's going on. Like, what do you want me to do right now? You know, this sort of thing, to get the horse stabilized, because there's so many different things that can cause colic, and it's helpful to have a vet that you have a relationship with that knows your horse, so that they can help better direct you as to what to do for right now until they get there, to help manage the colic based on pre-existing medical conditions and this sort of thing. So how do I know if my horse is colicky? If you've never seen colic before, it can be scary for sure. It can look also like many different things. You can have a horse that's dull or lethargic and just not acting like themselves. You can have a horse that is not wanting to eat. and is an appetent. You can have a horse that's rolling or kind of watching its flank, like in this photo here on the lower right-hand side of the screen. They can curl their upper lip. They can lie down, stand up, lie down, stand up. Sometimes it has to do with, maybe what you notice is they're not pooping as much as they normally do in combination with some of these other signs. They could be thrashing or sweating a ton, and they can also be trembling or shaking. Those are two other things that sometimes we see when things are pretty bad. This infographic shows, just in picture format, what we just kind of talked about in terms of what you might see as a horse owner in a colicky animal. And one of my, one thing that I wish horse owners would all know is that even though your horse is passing manure, it can still be colicking, which I feel like is such a common misconception. And it's something that I wish people knew, because sometimes that will cause them to delay calling a vet because they think, oh, my horse is pooping. It's okay. Like, it's going to be fine. It's passing manure. There are a lot of reasons why the horse could still be pooping and still be colicking. So the bottom line is, just because your horse is still pooping doesn't mean it's not colicking. And if it's exhibiting those other signs that we talked about, you should call your vet. So what does a colic workup look like? When your veterinarian will arrive at the farm, the first thing, if they've not already done it over the phone, is to collect a history. So does the horse have a history of colic? Has it ever had colic surgery before? What is the horse fed? When did it eat last? Has it been drinking? All of these sorts of questions. Then when we get there, the first thing we'll do is do a physical exam where we take its temperature, pulse, respiration, listen to its gut sounds, look at its mucous membranes, like its gums, measure its digital pulses. The next step is usually to sedate them and to give them pain medication to try to get them feeling better before we continue on with the rest of the colic exam. You might also see your veterinarian do, most times they'll do a rectal exam to see if they can feel what's going on in there, because, our arms are a couple of feet long. The horse's, GI system is, we can only feel a portion of what's going on, but we can feel a decent amount when we put our hand in there and do a rectal exam to get a better idea as to what's going on with various portions of their gut. You'll probably also see your veterinarian pass a nasogastric tube. That's a tube that goes from the nose into the esophagus down to the stomach. And that can be helpful to decompress the stomach and to see how much material is in the stomach. And we'll often lavage or wash water through with different medications to leave behind in the stomach, depending on what the rest of the clinical picture looks like for that horse. Sometimes we'll do a belly tap. So we'll take a sample of fluid from the abdomen and look at that under the microscope and see what the population of cells looks like. If there's any feed material in there, is there any blood, like these sorts of things. Sometimes a horse that's colicking, depending on what the diagnosis of the colic is or where we think the problem is coming from, they can benefit from going on IV fluids, just like people. We put a catheter in their neck and they're given fluids this way. Sometimes they need to be hospitalized and sometimes they need surgery. There are some problems that we cannot correct without surgery. And again, that's very specific to so many factors about your horse, like age, previous colic history, and what your vet finds on the cursory exam that they do on the farm. So surgery can be indicated. And I feel like there used to be this idea when it comes to colic surgery about, horses never surviving colic surgery. That is absolutely not the case anymore. Like, we've become pretty proficient at doing colic surgery. And of course, it depends what's wrong. The prognosis might go up or down, depending on what part of the gut is affected and what the actual problem is. But colic surgery is not the death sentence that it used to be. So if you have a horse that is colicking really badly and your veterinarian recommends they go to a referral center, and that surgery might be an option, that's okay. Like, don't panic. It's just sometimes different problems can only be corrected with surgery and can't be fixed medically. This is a quick and dirty series of photos of what the horse gut looks like, what its gastrointestinal tract looks like. And there's, if you look at the infographic on the left, like 10 to 12 feet, 70 feet, 4 feet, like there is a ton of gut in there. So a lot of square footage for things to go wrong, or square meters, I should say. Okay, let's talk about choke quickly. So choke is esophageal obstruction, and this is what it looks like. Okay, you'll go out to the barn and you'll see feed material pouring out of your horse's nose, slobber coming out of its mouth, and it's scary because they can often be coughing a ton. They can kind of do this like reverse sneeze thing, like because it's uncomfortable and they've got stuff stuck in their throat and it's got nowhere to go because horses can't throw up. So when they eat something that, you know, if they eat dry feed that's stuck in their esophagus, or hay cubes that haven't been soaked well and they get stuck in their esophagus, the food has nowhere to go, which is why it comes back up out the nose and you see this gross stuff coming out of their nostrils. It's feed material. So the treatment for chokes are most often they'll resolve on their own actually before we even get there. But the first thing you can do as an owner is massage the neck. Okay, massage the neck. If you can feel where the choke is, sometimes it's helpful to get the motility of the esophagus going with some digital pressure. Like, don't squeeze the living daylights out of the neck, but if you just give it a little gentle massage, sometimes that's enough to kickstart things. But if it's not, no worries. When we get there, we'll start off by sedating them, give them pain medication. We'll try passing the nasogastric tube, so same tube that we use in a colic workup, to try to relieve the choke. And oftentimes we have to flush water through the tube and kind of create a bit of like a siphon type of effect to wash either the choke down, or we dilute it so much that it comes out the other way in the form of nasal material, like material coming out of the nose. If the choke is really bad, which sometimes horses choke really badly, and sometimes they have a couple different sites of choke in their esophagus, they might need fluids if they're really dehydrated or if it's been going on for a long time, as well as antibiotics. And sucralfate is just another medication that I put on there that kind of forms a band-aid or a coating over areas of mucosa that's damaged. Basically, it sticks to the damaged part if the choke has been there for a while and they've got sore esophagus. The sucralfate can help. In advanced cases of choke, sometimes we need to scope them or do x-rays as well.
So I have a question, Kim.
Yeah.
So if you put down the tube and you're putting down some water to try and flush it back up, how do you prevent it from getting aspirated into their lungs?
So that's a great question. We sedate them really well, because if they're throwing their head around, that's when when the fluid is circulating in that pharyngeal area, the area of the pharynx. If they're chucking their head around, that's when it's at risk of kind of going down the wrong tube. So we sedate them really, really well so that their head is almost on the ground when we're dealing with the choke, so that it doesn't really have an option to do that, and it has to run out the nose. And that's another reason why sometimes we have to put them on antibiotics, because if they've been choking for a long time, there is a chance that they could have aspirated on their own before we even put the tube down there. So if that's the case, you know, classic example is old horse in a field, brought in after 2 days. Oh my gosh, it's choking. You know, we don't know how long it's been choking for. So sometimes that's why we give them antibiotics, is to try to mitigate the risk of aspiration pneumonia, because absolutely that's a complication that can happen. Fortunately, it's not super common, because usually we catch a choke before it gets too bad, because the signs of choke are so obvious. But sometimes there's nothing you can do and they do develop aspiration pneumonia. But usually we try to, if it's been a choke that's been lasting a long time, or a choke that's difficult to resolve, that's taken us a couple of hours, because sometimes this takes a couple hours to fix. It's a bit of a painstaking process, but sometimes they do have to go on antibiotics.
Okay, thanks.
No problem. Okay, so that's choke 101. Let's talk quickly about foot abscesses, because this is another really important one. So classic presentation is you get a call from your barn manager, or you go out to see your horse and they're hopping around on 3 legs. So Fluffy is dead lame. He looks like he's got a broken leg. 8 times out of 10, if that's the description you're getting from somebody and there's no other obvious areas of heat, swelling, sensitivity, 9 times out of 10, it's probably a foot abscess. That being said, horses can still break legs and develop catastrophic soft tissue injuries that can cause them to be really lame. But usually when it's like, holy smokes, yesterday they were fine, today they're super lame, most of the time it's a foot abscess. And so a foot abscess is caused when bacteria basically gets trapped inside the foot, whether there's weakness in the white line, whether you have a hot nail or bacteria got in, when the farrier was tapping the nail into the foot. It's possible, the horse's feet are disgusting and filled with, there's bacteria everywhere. They wade around in manure all day. So it's possible that, when the farrier was tapping the nail into the foot, bacteria got brought along with the nail, caused a bit of a local infection, which all of the ways that bacteria get into the foot, the reason why abscesses are so painful is because they create a lot of pressure. And there's only so much room in the foot. There's a lot of structures in there, but when you have a localized area of infection and there's a bunch of pus around it, which is essentially what an abscess is, that creates pressure and it's extraordinarily painful until you can relieve that pressure. So what's helpful is to call your vet or your farrier out. We'll put hoof testers on the foot and see if we can isolate an area that's bothering the horse. And then if we put the testers on and the horse is, yanking its leg away when we're putting pressure, say, at the toe, like as in the example in this photo, then we know, okay, let's take the hoof knife and debride the foot and see if we can pare out the abscess to expose a tract and relieve that pressure. We'll also often give them pain medication. We can pack the foot with, there's different products out there. Magnapaste is one of them, Animalintics poultice pads. Some people like to use diapers and Epsom salts. There are many options for packing a foot, depending on what you're comfortable with. There are many options of how you can effectively pack a foot. And we just need to wait for that abscess to drain. And sometimes that takes a long time and it's hard to watch your horse be in pain and be hovering that foot off the ground and be limping around. But it's important to, continue to give them pain medication until that sorts itself out. But usually if your vet or farrier is able to pare out the abscess, the relief is generally pretty quick. So just something to keep in mind if you go out to the barn and your horse is limping around, foot abscess would be the first thing I would maybe think of if the lameness is really bad. Obviously, there are many other things that can cause lameness in horses, but for acute lamenesses, this is what we should think of. All right, let's do a quick little 411 on cellulitis. This is another really common emergency. So classic presentation is, holy smokes, came out to the barn, horse's leg looks like a stovepipe. Very swollen. It's very hot, it's very painful. So this happens when there's a break in the skin barrier somewhere. Sometimes we can see it with our naked eye, sometimes we can't. Sometimes there's a cut associated with it, and sometimes we never figure out where the little pinprick was. It could have healed over, you know what I mean? Like we don't always see a super obvious wound with cellulitis, but it happens when bacteria from the skin gets in under the skin and proliferates and in the subcutaneous tissue. And that is a perfect environment for bacteria to grow. It's warm, there's minimal oxygen, it's juicy, like it's a perfect environment for bacteria to grow. Those bacteria create a localized inflammation, and essentially the blood vessels and the lymph vessels can get leaky, which is what causes the swelling that you see. So the treatment for this is to administer, obviously, pain medication. Buterbanamine usually is what we would reach for. Sweat the leg with, you can either use like DMSO-puricin or alcohol, or there are various ointments that you can use to sweat the leg. Antibiotics are required to make this condition go away. It will not go away on its own, which is why if you come out and see this, please call your vet, because this is not something that's just going to go away. And it will continue to get worse as those lymph vessels and blood vessels continue to swell. The treatment plan also would include controlled exercise, cold hosing with pressure, and wrapping the legs. And if this is left as a chronic problem that's not treated, horses can develop some pretty decent scar tissue that make it hard for the legs to shrink up to their original size, so to speak, just due to chronic inflammation. So that's kind of the nitty-gritty on cellulitis. And these photos just show how bad it can get and how ugly it can look. And these horses are really, really painful. The last condition I think we'll chat about that we'll have time for is hives. So super common problem. Hives are usually not something that you need to be super worried about. Many things can cause hives in horses. These photos are pretty significant cases of hives, and sometimes they don't look like this. It can just be a few little speckles of swelling here or there. But just like in people, if you've ever had hives, they're so itchy and so annoying. So there are things that we can do to help the horses to make these go away. And when we think about why they happen, it's kind of the same as in people, you know, like either they've had a reaction to some medication that was given, or a supplement, or a food item. Maybe they were exposed to an allergen, like a certain type of dust or pollen or mite. Maybe they came in contact, maybe you just washed a blanket, you know, and you put the new blanket on them. It was washed in a different detergent and they're allergic to that detergent. Or a fly spray. Maybe you sprayed them with, you know, a fly spray that they're not used to getting, and all of a sudden they've developed these hives. So many reasons why they can develop hives: bee stings, insect stings, all of these things. So mainstay of treatment is try to identify why they develop the hives. If you just introduce new bedding, new pine shavings, or new peat moss, or new straw, or whatever, remove the thing that changed. So whether that's the fact that they were just clothed in a blanket that was washed in a new detergent, or whether they were just exposed to new bedding or a new supplement or something like this, remove the offending allergen if you can identify it. You can't always. Then usually we give them corticosteroid like Dex, you've probably heard, which is dexamethasone, which reduces systemic inflammation. So that's a very helpful medication, which your vet will be able to either give to you or come out and administer to your horse if it has hives.
So,
and then, sorry.
No, sorry. So with the steroid, is it a one-time treatment, or is it the course of a couple days? How does it usually work?
It kind of depends on the severity of the hives. So if you kind of nip it in the bud and you figure out what's causing the hives, or they only have very mild hives, sometimes you can get away with just one dose of steroid. However, sometimes if the hives are really bad, like in this first photo here on the left, that horse would probably need a few doses of Dex to make those hives go away. And usually we do a tapering dose of Dex as well. So we'll give them kind of a blast, not a blast, but more Dex to begin with on dose number 1. And then over the subsequent couple of days, we'll give them less and less each time. So we kind of taper them off of the Dex. So it depends on the severity of the hives.
And is this medication usually IM, IV, or oral?
It can be given in many different ways. So it can be a powder. There's a powder form. There's an injectable form that can be given both intramuscularly and intravenously. So all of the routes that you just suggested can be ways to give Dex. And it depends on the horse owner's comfort level. Like if they're comfortable doing IM shots, great, we can give Dex IM. If they're comfortable doing it IV, it'll probably take effect quicker. But that's also a fine option. And if they're not comfortable giving shots, that's also fine. You can give it by mouth, either in feed, or if you want to dissolve it in some water and syringe it in the mouth, that's fine too. So a bunch of different ways you can give Dex.
Thank you.
No problem. So instead of me continuing to talk about this stuff, I thought maybe we could take an opportunity to do some questions and have maybe a bit of a discussion if there's different points of interest that folks would like to talk about some more, or if there's something that was not covered in this presentation. I'm happy to do my best to answer whatever questions that you might have about said illness or medication or protocol, because horse health is, I mean, I went to vet school for 4 years, so I can't possibly cover this all in a matter of an hour, but I'm happy to answer whatever questions anybody might have at this point.
There was someone on last month who did have some questions. She had draft horses. I'm sorry, I don't remember her name. I'm not sure if she's on again today. Stephanie, do you remember who that woman was? No, I guess she's not on today. So for senior horses that are ridden lightly, like twice a week, how many calories do you recommend that they get per day? And I know that's between the hay and whatever kind of concentrate you're giving.
My biggest suggestion, and probably the most practical way to go about that, like I can give numbers of calories, but for a lot of horse owners, that's not like, it's hard to compute because you have to do some math to figure that out. So the easiest way, if you're trying to figure out what do I feed my horse, like I have food XYZ, how much do I give them? So on the bag of feed, it will tell you, it will say, okay, horse is 1,000 pounds and is in light work. Here's how much concentrate to feed, you know, every day. So maybe it's 2 pounds, which could be however many scoops, depending on how large your scoop is, which will be a varying amount of calories. So I guess in a roundabout way, my suggestion to that is to check the bag, because and I guess maybe another way to think about it too is the amount of hay that they should get is 2% of their body weight. Okay, which a lot of people, that's kind of hard to conceptualize, but one helpful thing that you can do to weigh their hay is to get a luggage scale and get a hay net and stuff the hay in a hay net and then weigh it with a luggage scale, so you know how many pounds they're getting. And that's a little bit labor intensive. I recognize that, and not everyone has time to do that. But in an ideal world, if you're trying to figure out how many calories you're wanting to feed your horse, I guess I don't have like a hard and fast number. I would go more on body fat, like more based on percentage. So 2% of their body weight in hay. Now, let's say they're obese and you're trying to put them on a diet, then we're going to drop that down to 1.5% of their body weight of hay, and then supplement with whatever grain based on the level of activity, and based on the feed chart on the bag of grain. I think that's probably practically, rather than give a number of calories, which, to be honest with you, off the top of my head, I don't even know if I know the amount of calories that they should get in a day, because it depends on the horse's weight, their use, what feed they're getting. Like again, it goes back to that whole answer of it depends. So I would go based off the feed bag is the long and short of it, I think. What are some of I see there's another question here. Let's see. So the question is, my daughter is the primary caregiver. She's helped me learn a lot with our vets. This has been a great review and reinforcement. Could you give an overview of PPID and insulin dysregulation? This is another of those broad areas, but hearing your insights would be helpful. Yes, for sure. So PPID stands for pars pituitary intermedia dysfunction, which is a big long word, a fancy word, which equates to Cushing's disease is probably what you've heard it be called before. So that is a brain problem where there is a dysregulation of hormones caused by a problem in the pituitary gland, and the specific part of the pituitary gland that is causing the problem is the pars intermedia. So that's where the acronym comes from. So Cushing's is a total, it's so important, especially for people that own older horses. It's an important thing to talk about. because it can affect so many different parts of their body, from, the speed at which they can heal soft tissue injuries. In horses with unregulated Cushing's, if they have a rupture of a tendon, that is going to take 10 times longer, not 10, but it's going to take longer to heal if they have Cushing's versus if they don't, or if their Cushing's is unregulated. So soft tissue healing, abscesses will take longer to heal. Generally, their immune system is kind of not quite as good if they have Cushing's, especially if it's unregulated. And so what do we mean when we talk about unregulated Cushing's? Okay, so that means that their ACTH, which is adrenocorticotropic hormone, that is the hormone that we care about in horses with Cushing's, that we measure to figure out whether we are on top of treating the Cushing's by monitoring this value. So there are different ranges depending on the time of year for Cushing's as to where that value is allowed to be. So in horses in the fall, they have a seasonal rise in ACTH, whereas during the rest of the year, it stays kind of consistent. So there are different times a year that we prefer to measure ACTH to see if A, your horse has Cushing's, or B, if the Cushing's is appropriately regulated. So times not to check would probably be in like October, November. We try to test outside that window because of the seasonal rise. It just gives us a better idea as to whether the ACTH value is true and correct, or whether it's high because of the seasonal rise. So the drug that we use to treat Cushing's is called Presend or Pergolide. So the Presend is the brand name. It comes in a pink box. You've probably seen it kicking around the farms that you folks are at. And it works to normalize that ACTH value. So the Presend is kind of the mainstay. Different horses need different amounts of Presend. Usually a standard 1,000-pound horse will only need 1 milligram of that every day, which is 1 pill. But sometimes that's not enough. When we retake their ACTH values, say they've been on Presend for, I don't know, a couple of months, and we want to see if that dose is appropriate for them, and we retake their ACTH, which is a blood sample. We can test that based off of a small little blood sample. We might need to adjust the dose. There's a tablet form of this. There's also a liquid form, a compounded suspension that some horses prefer. Side effects of that medication can include lethargy and appetence. Those are the big two. Sometimes attitude change. They can get a little kind of dumpy or dull when you first put them on it. So sometimes it's helpful to wean them on that medication instead of going from 0 to 60 in 3.9. You know what I mean? Like to start off giving a quarter tab, then once daily, and then maybe next week we give a half a tab once daily, and the following week we do 3/4 of a tab. So a slow wean on that Presend is typically the best way to get around the side effects of the drug, because we do see them, unfortunately. But Cushing's is a really common problem in horses, especially over the age of 15. But I've seen Cushing's. The youngest patient that I had was a little mini, and she was 4 years old, and she had Cushing's already. So signs of Cushing's include long hair coat, failure to shed. Maybe their hair coat is like curly. They can have a crusty neck. So the top of their neck kind of jiggles when you hold the top of their mane. It's like a piece of like meat, I guess you could call it. It's hard to describe without having a horse in front of me, but a crusty neck. And then they can have regional adiposity as well at which is basically pockets of fat at the base of the withers, sometimes at the base of the tail. This sort of thing. So those would be signs of Cushing's, the drug that we use to treat the disease, and just kind of the basics of Cushing's. Insulin dysregulation is a whole other thing. So also common in older horses. This clinical signs can look a little bit different though. A lot of times in horses that are insulin resistant, they can look really fat, like obesity is a common sign. They can have still that crusty neck. They can have a big barrel, fat pads everywhere also. Sometimes these horses that are insulin resistant can have recurrent abscesses, less so issues with the coat. That's more of a Cushing's thing, but a lot of times the two go hand in hand. So a lot of times horses with Cushing's also can have insulin dysregulation and vice versa. They're kind of like sister diseases. So the way that we treat insulin resistance is a little trickier. So there are medications that we can use, Thyro-L, which regulates their thyroid hormone, which is levothyroxine is what's actually in Thyro-L, can be used. Metformin is a drug that's also used in people that can help with weight loss. So sometimes in these super porky insulin horses, they need a little bit of help to lose some weight. So that's where the metformin comes in. And basically, with insulin dysregulation, the body can't regulate glucose. And that's when we run into problems with the rest of the metabolism. There are supplements that you can put horses on that have insulin dysregulation, like Insulin Wise. And like I said, we do have some drugs that are now becoming more available in America. They're called SGLT2 inhibitors that are actually used in humans with diabetes. So now we're seeing some of those on the market to help decrease our horses with really high insulin, because essentially those drugs work by increasing the amount of glucose that the proximal renal tubule in the kidney is able to kick out, so it gets excreted in urine. So I don't know if that is helpful for Cushing's and insulin dysregulation, but that's kind of the nitty gritty. And then also, I guess, when it comes to food, if I'm able to offer one takeaway for feeding these horses with Cushing's and insulin dysregulation, it's to try to minimize the amount of sugar that they're getting in their food, because that can kind of tip the scale with both Cushing's and insulin dysregulation. So you're going to want to make sure that you're feeding either super minimal amounts of grain, or you feed grain that's appropriate for horses that are metabolic, that has a very small amount of sugar in it. So you want to avoid things like a sweet feed, that's soaked in molasses. You want to avoid stuff like that in horses with Cushing's and insulin dysregulation. Is that helpful? Maybe you could just mention in the chat if that sort of addresses your concerns with Cushing's and insulin dysregulation. Perfect. Okay. What are some of the benefits of soaking feed? Great question. Soaking feed is good to increase the amount of water that your horses are ingesting. So especially when we see these weather changes, like it goes from being very cold outside to like below freezing, and then the next day it's like I have a hard time like thinking of the world in Fahrenheit, because I grew up in Canada and I think in Celsius. But when it goes from like 0 to 20 degrees, which I think is like, I don't know, something like 70 degrees in Fahrenheit or something like this, horses really struggle. They'll go from drinking a ton to not feeling like they need to drink anything. And so they'll become dehydrated, which predisposes them to developing like impactions and things like this if they're not getting enough water. So soaking feed is a great way to make them drink more, because they want to eat their food. I mean, most horses are pretty food crazy, like they like grain, it tastes good. So by soaking it and adding water to it, it's helpful to make them drink. Because you can lead a horse to water, but you can't make them drink. But adding water to feed is an awesome way to force them to drink. Other reasons it's helpful, if you have an old horse, or not even necessarily an old horse, you've got a horse with dental problems. If they have trouble chewing food, if they've got lost or broken teeth, or like funky waves or steps or ramps or crazy hooks, or this sort of thing, it can be helpful to soak the feed and make it nice and mushy so that they can chew it easier, and it's easier for them to swallow. Other benefits would be being able to decrease the risk of choke. So when you're feeding dry concentrate, so dry grain, it just slides down the tube, slides down the esophagus better if it's wet, versus if it's dry, and it's less likely to get stuck. So those would probably be the main benefits of soaking food. We have him on percent, insulin-wise, and minimal grass. Perfect. TAF, hay, or primary forage, and then a balancer. That sounds good. Most balancers are pretty are geared towards providing horses with the necessary vitamins and minerals in a low sugar manner by just offering them a small amount of balancer. And it's also helpful because the horses will then think, oh, yay, I'm getting grain, you know, with the rest of the horses in the barn, even though they're only getting a small amount of balancer. And it also provides a means to give any supplements or any medication too, if they're already getting a little bit of grain in the form of balancer. So it sounds like you're doing the right things for your horse that is Cushingoid. So hopefully the horse continues to do well on that regime that you've listed. If anybody else has any questions, please put them in the chat and I'm happy to do my best to answer them. Now I understand why we soak our grain. Yeah, perfect. Awesome. Soaking grain is awesome. And it's awesome not just for senior horses, but I think it's helpful for horses of all ages because, again, like when we have these weather changes, sometimes the youngsters decide not to drink too. So soaking grain is never a bad option, in my opinion.
I have a question on adding on to my question earlier about soaking feed. I have a friend who, unfortunately, I was on the last class before, and I mentioned that she kind of overfeeds her horses, but I kind of keep my mouth shut because she doesn't really listen to my opinions very well. But she gives her horses a electrolyte and soaks their feed.
Yeah.
The senior he's maybe about senior in her mind. He's like, to me, 21 is not quite senior, but is close. And the other two are in their early to mid-teens. They're on light exercise. They each get about, I think Shorty gets almost like a pound of food after you wet it, which is to me insane because I'm used to high exercise horses, and these guys came from a ranch, so they were doing lots of work, and now they're just sitting out and chilling. And they get a beet pulp mixture, they get an electrolyte, they get senior feed. All three horses get senior feed, and then they get a balancer feed mixed into that, and then they get a couple of other like powders. And I always ask her why she soaks her feed for the younger horses when they've been on dry food all of their life. They've never really had it wet. They've never really needed it wet. And she expressed some concern in it pretty much allowing that mixture, that powder mixture, to mix. I've had horses at home that have never needed. I have a mare that gets a metabolic, like something for her metabolic system that's a powder, and she just inhales it with her dry food. But I just didn't know if there was something I was missing or something that I just hadn't learned yet. Nutrition.
Yeah, totally. I'm glad you mentioned the electrolyte thing. I neglected to talk about that because I think all horses should pretty much be on electrolytes because, again, it encourages appropriate water intake. So thank you for mentioning the electrolytes, especially important in senior horses because we want to keep them drinking. So a lot of horses, like I see people feed grain all the time dry, and sometimes it's never a problem. You know, like if you have a horse that's a good drinker, that's never choked before, that routinely gets its teeth done, and that has no trouble chewing, like a lot people do feed dry grain all the time, and that's fine. I think maybe where the soaking comes into play is with weather changes and senior horses. Those are kind of the two things in my mind where it becomes especially relevant. But so I know what, we have so many clients whose horses that we care for that never soak their grain, and it's never an issue, but it's also never an issue until it becomes an issue. So if you can avoid them choking, especially again, if they're like senior or they have known dental pathology, if you can avoid that by soaking their grain, I mean, it doesn't really take that much work if you just toss a hose in their bucket for a second or two and then mix things around, because some horses will also pick, like, they're crafty. They can pick out medication. They can eat around powders. So the soaking it and mixing everything together is a valid point as well, just to make sure everything's like homogeneous and well mixed, so that they don't really have a choice of what they can eat and what they can't eat, because it's like the equivalent of a cow TMR, like a total mixed ration, if they can't sift through it.
Okay. And then nutrition, like I'm still learning nutrition. I'm going back to school next year for equine nutrition because it's something
Nice.
I'm going to learn a little bit more about.
Great.
And it's always interesting for me to sit there and know what I already know from having horses as a kid to riding now to learning what I've learned from my mom. That there are things that concern me and things that also don't, and things that I can't say to her in a nice way because I feel like I'm coming in a bit headstrong. Both of the younger horses she feeds electrolytes in the morning and at night, and they get hydration hay during the day. And they have full access to 2 of those giant gallon waterers that you can buy at like Tractor Supply or something, not the galvanized ones, but the plastic ones.
Mhm.
And they get hay, regular hay all day. I think they get a round bale for 3 horses, and they're not drafty. They're kind of just fat core horses and a Welsh pony that's just kind of there to bully them, which is kind of cute in a way. But I just didn't know if there was something that I was kind of missing or overreading or something. And I like to hear like other people's opinions. I did lease out the one horse for a couple of weeks. And then at some point she believed that I was supposed to be feeding him. And she asked me to make a feed chart for him, and I did. And she was like, "This is ridiculous. He's not a baby. He's an adult." And I kind of pulled back out of the whole situation. But nutrition wise, I was kind of like, why are they getting electrolytes almost 2 times daily? And then hydration hay for lunch. They just kind of full of water. And the one that I was working with is, I would say, I think what my friend's aunt said was that he looks almost 14 weeks pregnant.
Okay.
And he doesn't really do a whole lot of running. The other one does a lot of running, but other than that, not so much. But
Yeah, grain is not for everybody, and not everyone, like we have horses that we care for that don't get any grain, and they might just get like a handful of balancer, and we have horses that we care for that don't even get that. They just get their hay, and that's all she wrote. And that's fine for some horses, but it all depends on their exercise needs and like keeping a careful eye on their body condition score. There are many resources online, like charts that you can follow to, they direct you as to where on the body you can palpate and examine to characterize where the horse is at in terms of its body condition. You can also weight tape the horses, which is a really helpful tool for owners. It's like a giant measuring tape that goes around the barrel at the base of the withers. And that basically equates to how many pounds or kilos that they weigh as an estimate according to how large that circumference is. So in terms of trying to determine whether the horse is being fed the correct amount of hay and or grain, I mean, there are blood panels that we can do to see if their vitamins and minerals are appropriate. They're costly. And typically, if horses are being fed a balancer and the 2% of their body weight, or 1.5% if they're on a diet of their weight in forage, that's sufficient. And we usually don't have to go down the route of getting nitty and gritty about their specific levels of, calcium, phosphorus, selenium, like all of molybdenum, all of these random, they're not random, but, vitamins and minerals. It's tricky though. And nutrition is one of those things, as I'm sure you'll learn when you go to school for it, that there's not ever really one right answer. And there are tons of nutritionists out there that will probably tell you a different thing for the same problem. So the weight tape is a helpful tool, and just making sure that, if they're on a primary forage diet, that maybe you give them a little bit of balancer just to sort of even out what they're getting and make sure that all the essential vitamins and minerals are kind of covered. So the other thing I will say, I have no affiliation with this company, but I have found it useful for clients, is Mad Barn. They offer free nutritional consultations over the phone or online. And I haven't found them to be very sales pitchy when it comes to trying to sell their own products. But if you have a specific nutrition question, they have board certified equine nutritionists on staff that are able to help field questions in terms of how much of this, how much of that, should I eliminate this or eliminate that? I found them helpful. It's Mad Barn, MADBARN, Mad Barn. It's a Canadian company. Not to plug my Canadian origins, but they do have a good system in place if you have nutrition questions.
Okay, thank you.
Yeah, no problem. Thanks for your question.
Well, Dr. MacKinnon, this has been incredibly informative. Above everything else, I love your enthusiasm for really your subject matter, and certainly meeting you for the first time. I guess you made the right employment choice. But I think, we've seen several messages in the chat that really all of us feel that your presentation has just been phenomenal and,
Yes.
second to none. So appreciate your knowledge and your skills and your opinions, and just great to have you with us tonight. For those people that are still on, this has been recorded, and once we receive the PowerPoint from Dr. MacKinnon, I will make sure that everybody has access to it. And I think, Kim, what is your feeling? I know you had put some contact information there at the end. If people have any further questions, can they send you an email? Are you open to that?
Absolutely. If you have any questions about anything we talked about tonight, if you have questions about anything we didn't talk about tonight, I am more than happy to reach out either over the phone or by email, or if you have your own personal horses and you're wanting a vet to come out, if you're in our practice radius, I'm more than happy to touch base with you and to sort that out. We're based out of Brewster, and we go about an hour is kind of our practice radius. So if you're in that range and would like to chat about, even if you're not in the range, just reach out to me. I'm happy to talk about whatever you have questions about. My contact information is here on this slide. You can reach me. That's my work cell phone number, or my work email is also listed on the slide. So when the PowerPoint gets disseminated, you can find me there. And I'm happy to chat with anybody about anything. I love this job. I think this is the best job in the world. And I'm so grateful that you folks gave me the opportunity to chat about some veterinary related things tonight. And yeah, thanks for having me.
Super. Well, like I said, it's been our pleasure, and your presentation has just been second to none. So very beneficial. And we appreciate your time this evening. Thank you for giving us your time as well. So if there's nothing else, then I will say good night to all of you. And I'll be disseminating the slides shortly. And until we meet next time, for those of you that will be joining us, and for session 3, it's April 11th, and we will begin the conversation of the end of life discussion and pet trust planning. So we look forward to seeing you all next time. So